Good. Good. Just a little drop, yep. Oh, beautiful. Good question. One more in there. Drop that shoulder for me. There it is.
Yeah. Wow.
Hey everybody, this is Dr. Brady and Dr. Nick from Kalkstein Chiropractic here in your Charleston area chiropractor. All right, so what I'm doing right here, I'm just kind of looking at the musculature all along those rib heads there. Just kind of playing with each rib head, palpating and adding motion in them as well. So if there was like a really, really bad case of scoliosis and say there was like hypertonic tissue here, it's really locked up, we have modalities such as like dry needling, laser to really be focal to those areas to break up that tissue. But since Nick's here right now, I can show you the adjustments here. So take a nice deep breath in and all the way out. Yep. Can I actually have you just on your side facing me here?
Oh, sure.
And another thing I use is strapping as well. I don't know if you do that every once in a while for the posture. With scoliosis.
In what sense?
Yeah, just like bringing the shoulders back sometimes. They're
Taping,
kind of
stuff like that. Yeah.
Taping.
Yeah.
That can be a very useful
It's a
tool.
nice, yeah, a little bit of.
Good. And at least until you get into that posture and build that mind to muscle connection, I think it's very beneficial in the first few weeks there.
So a little disclaimer, you really can't fix scoliosis unless it's surgical.
Yeah.
What we can do here, go ahead.
Just a little drop, yep.
Oh, beautiful.
We're gonna eval his toe today. So truth be told, there's actually not an extensive evaluation process for this, but Dr. Warren, how about you tell us what's been going on with your toe? This is a very history-heavy diagnosis.
And just a little bit of increased activity in the form of attempting to run a marathon with not a ton of training prior. It's kind of a perfect recipe to set this off. And I've had this problem before in the past relative to pain in my big toe. And then, sprained this ankle probably 15,000 times playing lacrosse and trail running. So I think I've even done some dry needling videos with you before in that area, and then I've just I've noticed, I was like, wait, why am I not? I'm walking a little funny on this area, and then I was treating patients this week, and I was in a lunge position, and I cranked down my foot and my toe in flexion, and I did not do that much more of that the rest of the day because it hurt so much. So I was waiting for a little break in our schedule, and I was waiting to hear. I'll let Dr. Alec take it from there.
Okay, so ladies and gentlemen, what he's essentially describing is what's known as turf toe.
Remember when Todd Heap had turf toe?
I don't know if I do.
Okay, so he's a tight end for the Ravens, and he was a Mormon, so they don't take medication, they don't do anything from a surgical or injection standpoint, and I just remember it took him a long time to heal from it.
Yeah, I mean, turf toe aptly named after the incidence of this particular injury once they started implementing turf fields in a lot of the professional arenas. What turf toe essentially is either a one-time traumatic dorsiflexion injury of the toe. Frankly, it could be a plantar flexion injury as well, or it could come in the form of repetitive stress. So at the end of the day, it is a injury to the capsule around the first metatarsal phalangeal joint.
It hurts so much.
Okay, Talk to me about what specifically is hurting you.
More so the top of the foot, I think. Right there in the top portion of the joint, maybe a little bit more.
So are you having pain with extension?
A little bit. If you crank down a little bit more, maybe I could tell you.
Pain with flexion?
That's not that bad.
Okay. What if I tug on her?
Not crazy, man.
You're actually doing pretty good. Okay.
Yeah.
What if I adduct you?
Starting to feel the sensation there.
Okay. So at this point, I'm just challenging the capsule in a couple different ranges of motion, figuring out what maybe direction he in fact injured it in. Pain or discomfort when I abduct you?
That's the easiest so far.
Easiest one so far. But you feel like if I really gave you some juice.
I'm already, it's starting to kind of turn it up a little bit.
Okay. So that's really consistent with the typical turf toe injury. He doesn't like me really jamming him into dorsiflexion of that big toe. So once again, it's a challenge to the capsule, an irritation to the capsule. I took the shoe off to check for any bruising. If we saw some bruising, we're probably most likely suspecting a grade 2 injury, which at the end of the day, that only changes prognosis. It doesn't change the capability for it to heal. But if I saw a lot of bruising as well, I might consider radiograph, given how traumatic the incident was, to just make sure that the first toe isn't in fact broken, which would kind of clear me to do whatever manual therapy I wanted. So I'm looking at this, there's no bruising, no ecchymosis, he looks really good. I can challenge him in most directions. I know he's been walking, his gait's a little funny, he's afraid to put pressure on his big toe, so he's swinging out a little, he's over supinating just a little when he takes his steps. And I'm just certain that is messing with the rest of his lower extremity chain. So in addition to doing a little bit of soft tissue work on your toe, I'm going to adjust your foot, I'm adjusting your ankle, I'm going to adjust your knee, hip, low back. I'm literally going to address the entire kinetic chain on the lower half of your body. And then after that, we are going to do shockwave, which he's not going to appreciate even 1%.
Yeah, it'll be intense for sure, but I'll appreciate being better. I don't feel like dealing with this thing, man. I just want to take a moment to appreciate Alec and his ability to deliver a really sound clinical diagnosis. So, like, if you're a student, I mean, I just think that's just such a nice presentation of him describing the majority of the cases we see as it relates to toe pain, which is going to be that irritation to that capsule there. And man, it was nice to listen to him talk, wasn't it?
I appreciate you.
Mm-hmm.
I tell you what, I snuck a little tool in my pocket because I didn't want you freaking out before I even got in the room here.
Oh man.
I'm going to use this little doodad, one of Dr. Warren's personal favorite tools. And I'm going to give him a taste of his own medicine.
Yeah, appreciate it though.
Of course. Just as and listen, this isn't crazy. I'm not trying to inflict pain upon him. I just want to stimulate a local inflammatory response. I want to get blood into the area. Joint capsules typically have poor blood supply, just like a ligament or just like the most distal end of a tendon. So I want to do anything I can to stimulate some sort of metabolic activity in that tissue and expedite the growth process. But at the end of the day, that's where the shockwave device is really going to shine. And if I was feeling ambitious, I might even laser this toe too, Dr. Warren.
Yeah, I would say relative to our protocols with this problem, we have, let's just say to be frank, we can use as many things as we have here to the patient's advantage. We're gonna do direct tissue work to it in the form of soft tissue work, like he just did. He's gonna adjust my ankle, my knee, my hip, my low back. He's gonna look at all those areas, and then from a treatment standpoint, outside of this room, the shockwave therapy he talked about. Class 4 laser is a really nice addition to the shockwave. It helps kind of stimulate a good response to that protocol. And then,
I know, buddy.
That was wonderful. What are you talking about? That was great. No pain. That felt great. I feel like my toes better already. That was an awesome adjustment.
I appreciate
you.
you.
He's really quick. I definitely I have a preference towards Dr. Alec on his quick adjustments, especially in the extremities. You gotta be fast to get a good cavitation or be a good extremity adjuster. So if you don't like treat it a ton, like wrist, ankle, foot, like sometimes you can be a little slow and boggy on manual therapy in the foot, and Alec is anything but that. Crisp and clean.
Man, I appreciate you.
Yeah, man, you should teach how to people how to adjust. Look, I think you're teaching people right now. It's awesome, good. So fib head adjustment there. Doing a little sideline analysis of him working on me while he's working on me.
There was.
Oh, so there was a mortise joint or talar dome, long axis traction. Got a clean cavitation on my ankle. A lot of times, what people present with this problem, it's like, wait, why is that capsule getting so irritated? And he talked about it quickly and fluidly, but a lot of times there's stiffness here. There's stiffness or immobility in the anterior hip capsule. They have a hard time getting good extension in their front of their hip, which I actually do have a little bit just because I didn't properly train for this marathon. Paying for it.
I just want to say. Whoa.
You know, I'm a sensitive guy, whatever I say.
For someone who's as palpatorily inclined as you are to be so sensitive. So yeah, I mean, I can feel your SI joint from the front. It doesn't move that nicely.
Which side?
Your left. You're right.
Right, okay.
Okay. I would like to manipulate.
Go ahead. Yeah, I'm good.
Are you capable of turning on your side?
Yeah, I'm
Okay.
good for it, man.
I don't want to beat you up in any of these positions.
I might give you the leg a little bit. Yeah, there you go.
Would you like me to adjust you like a pregnant woman today? You got it.
So
It would be a joy. I'm gonna probably end up opening this too.
that's fine.
I just want you to breathe. So this is one way. If we want to take care with the lower extremity, sometimes we can get, or if there's a pregnant gal out there, this is another way that we can get some motion into an SI joint without necessarily hiking the knee up right into the abdomen like we typically do. I just want to see what you got. Yeah, man. You got that legendary mid back. Are you tensing up on me, Doctor?
I'm right here with you.
I swear, doctors make the worst patients. Dude, you're stiff.
I'm a little tight.
You
That's
run a
all
little
good.
stiff.
I was born that way, baby.
Hey,
Oh,
don't you move a muscle.
I know, I'm good for it.
Just want to make sure that side's moving the way I want. Can you turn on your other side? I know it doesn't move super duper hot.
Yeah. I'm gonna press pause on the video right now. Yeah, you're not dropping on that side.
Cannot.
No way. No. And then reestablish in 3, 2, 1.
Okay. So we move the side that doesn't move.
Yes.
Would it be at all possible just to get your face down super quick?
Oh, absolutely.
Just super quick. Oh yeah. Okay. So something we know that suffers when the lower kinetic chain is not functioning properly is the TL junction, the thoracolumbar junction. Because it is a junctional area and the joints are morphologically just slightly different than either the thoracic or lumbar counterparts, what you're going to see is in a person without an injury, without a gait disruption, that's where you're going to see a disproportionate amount of stress, load, or discomfort bore. But someone who is having gait issues, absolutely, his TL junction is going to be a little cranky.
My foot feels amazing right now.
Does it?
Yeah, I feel so good. Thank you.
It's a pleasure. I mean, I think you're anticipating me a little here.
So what golfer's elbow is a tendinopathy to the common insertion point of the wrist flexors. So that's going to be right into the medial aspect of the elbow. A lot of these people that come in with it describe a burning or a sharp kind of achiness right over the medial aspect of the elbow. Hurts worse with like gripping things or holding things. Any sort of wrist flexion, bending that wrist up is going to cause a lot of pain. And so golfer's elbow is classified as a tendinopathy that's broken down into two things. A tendinitis, which is the early onset that transitions into a tendinosis, which is the more drawn out kind of chronic issue. So if you come to us with golfer's elbow that happened a week ago, you're out at the golfing range, golfing course or whatever, and you're hitting some balls and your club head's really kind of chunking through the dirt and causing that wrist to jolt back, rapidly stretching these muscles through here, you're going to cause a little bit of micro tear, going to cause some inflammation. So with being within a week, it's fairly acute. So what we would do for you here is we would dry needle this tissue, followed up with laser, get you out on the rehab floor. So the acute stuff, the tendinitis aspect of golfer's elbow could really be easily managed with dry needling and laser. Dry needling is good at dilating some blood vessels, irritating the tissues a little bit in a good way to tell the body, hey, we need fresh blood here, we need to work on healing this area. Follow that up with the laser. Laser is great at allowing the tissue to utilize that fresh blood. So it kind of, in a roundabout way, expedites the healing process. So if you can get on top of it early, it's very, very easily managed. But if you let it get drawn out, you kind of go a couple seasons of golf and, it finally gets to you're like, I'm tired of dealing with this. That's more of a chronic issue. And so what we would do is a little bit more of an aggressive approach. We would shockwave this tissue. Shockwaves, more aggressive in the sense that it's really breaking apart some of those sticky adhesions, that scar tissue, kind of cobweb-like stuff that gets laid down when tissue is torn, then healed incorrectly. So shockwave is really good at kind of bringing it back to square one with the healing process. So shockwave, follow it up with laser, and then get you out on the rehab floor. The rehab's going to be a little bit longer in this case just because if it's a chronic issue, but if done appropriately, you know, we give you the tools to really kind of manage this on your own outside of here, and hopefully it doesn't come back for you. But if you guys have any questions about golfer's elbow, leave them in the comments below. Be more than happy to answer them for you. Brady, is there anything else you want to add to that?
Yeah, if you could help my golf game too, that'd be great. But no, it's a really good time, especially this time of year right before golf. So get in here if you're dealing with this, and it's not something like Nick said that you want to prolong, because then it could potentially get worse there.
Yeah,
Right.
absolutely.
Help me. Oh, wow.
Give me some freebies here.
Freebies, baby. Doctor giveaway.
All right, so nice deep breath in here for me, all the way out. Good. Yeah. There it is.
Oh, savage, Dr. Brady. Not even letting the T-spine piece breathe.
Why would we?
Good question.
One more in there. Drop that shoulder for me. There it is.
Yeah. Wow. That was pretty perceptive of you.
Impressed. Hey, let's go onto your back here then. So how many hours are you averaging on a given night here?
You know what? I'm probably getting 5 or 6 cumulative, but they're broken up.
Okay.
And it's not that I'm the one in the room every time, but you know, when my wife goes downstairs, I feel that. I wake up.
I gotcha. You're not in that deep sleep then.
No. No REM is being had. My recovery is hindered, I'd say. Oh, heaven help. Oh, wow. I tell you what, I haven't felt the joints in my neck move like that in a minute, man. Wow.
That's good. What are you up to nowadays? 315 for the squat?
I thought you were asking about my weight. I was like, all right, buddy. You gonna expose me like that? I got you.
No, come on now.
I didn't know this was a hard 75 check-in, man. Damn.
Nice video. I know you didn't ask for this, but
Listen, when I voyeuristically gaze into your treatment rooms, this is what I see happening.
This is it.
I'd be lying if I said I wasn't jealous. Oh shit.
Let's go a little bit deeper here. Might see a pants rip here.
I mean,
on the
we're
YouTube channel.
bargaining
Yeah.
actually for a pants rip. So let me hike them so that seam doesn't completely split on cam.
There we go.
Oh
I'm
wow.
just gonna lay on top of this here. Yep.
That's pretty crazy.
Yeah.
And that left anterior hip. Yeah, I knew. I was pinching my hip flexor when I was squatting. I'm comfy in a narrow squat, and I know that pinches my hip flexor.
Yeah. You always squat narrow then?
Dude, when I was in college, yeah, it's wider now, but when I was in college, I was squatting like that close.
Wow.
And I was in I was 450 pounds, and I was like that close.
Wow.
Yeah.
You deadlifted all today too?
No,
Is
I
that
did
part of your
not.
workout? No.
If I deadlifted today, this would be being shot from a hospital room.
I'd still be there with you, man. Just wanna let you know
Thanks,
that.
brother. Oh,
Right there. Yep.
man. I tell you what, you got the juices flowing this afternoon,
That's
Dr.
great. Yeah, you're keeping my hands warm. I appreciate it, man.
Yeah, that's what we do around here. Oh, wow.
Oh man, right through there. Yep.
Man. Guys, thanks for watching. We'll catch you again soon.
Appreciate you watching.